Jengelley, and Daenique is going to talk to us on the topic of pancreatic cancer cachexia for 800, Alex.
Hello, and welcome to Jeopardy, America's favorite question and answer game. Except today, I'll give the answers to the most asked question in my family, which is, when are you going to cure cancer? I research pancreatic cancer, which is the third leading cause of cancer-related deaths with the greatest % average weight loss among other solid cancers. This weight loss is a characteristic of a disease known as cachexia. Cachexia is the involuntary loss of a patient's skeletal muscle, fat, and bone with disease. Here, you see Alex Trebek, Aretha Franklin, and John Lewis, who recently passed away from pancreatic cancer. If you look at Aretha Franklin, you'll notice she appears to have sulking skin and prominent bones, which is characteristic of end-stage pancreatic cancer cachexia. 85% of pancreatic cancer patients will develop cachexia, which leads to muscle weakness, poor quality of life, and minimizes a patient's ability to function and can result in death. The major issue with cancer cachexia is that there are currently no approved therapies, and there are multiple mechanisms involved resulting in the overall impact of the disease. One area of complexity in cancer cachexia is chronic inflammation. Inflammation is the body's natural defense mechanism in response to disease, but in cancer cachexia, there is an increased demand for nutrients by the tumor and results in constant communication between tumor cells, immune cells, and muscle and fat tissues that robs the muscle and fat of their own nutrients and causes it to be weaker and thinner. One molecule, known as oncostatin M, is expressed during inflammation. Oncostatin M belongs to a family of other inflammatory molecules that drives inflammation and disease progression by binding to cell membrane-bound receptors, specifically oncostatin M receptor, and activating major cell signaling pathways. The role of oncostatin M in pancreatic cancer cachexia is not well known. We do know that high expression of oncostatin M receptor in patients with pancreatic cancer associates with poor overall survival. And I have shown that increasing the levels of oncostatin M in mice without cancer causes muscle and fat wasting. So my goal is to focus on the pancreatic cancer tumor microenvironment because the tumors comprise of a diverse group of cells that impact how tumors respond to drug treatment. My aim is to delete oncostatin M and oncostatin M receptor in mice and implant pancreatic tumor cells to determine how deleting oncostatin M would change the composition of the tumor and cachexia. I hope there is a reduction in the inflammatory response and decrease in minimal wasting in mice with deleted for oncostatin M compared to control mice, and how we can relate these results to people. So going back to our initial question, cancer impacts the entire body and there's no effective therapy for cachexia. In fact, we are still learning all the drivers that play a role in cancer progression. But the more we understand cancer cachexia, the closer we are to a cure. Thank you.
Awesome. Thank you so much, Daenique.